Hello, and welcome back to Hagan's New Jersey PIP Tips, where we bring you monthly segments on auto-insured personal injury protection, otherwise known as PIP. October started as a crazy month with a ton of rain for multiple days here in New Jersey. It was very dreary, but however, we were much more fortunate than those affected by the latest hurricanes. Our prayers, our thoughts go out to those all affected, whether Florida, Georgia, the Carolinas, Puerto Rico. We hope you're on your way to recovery, you've stayed safe, and for those who have lost, again, we're thinking of you. We'll talk a little bit later in the video what we can do to help those in need. As far as PIP this month, we'll talk about healthcare primary, which has become a recurring issue with some of my clients, so I'll address that briefly. We'll then have our featured provider of the month, Bergen Spine and Rehab, and then finally we'll select our new winner for this month. So let's get right to it and have an awesome October. So as I was saying, although we're finally getting nice weather again here in New Jersey in October, the start of the month was a very dreary and wet one. Probably the most rain I've seen in New Jersey continuously in a long while. However, again, we're much more fortunate than those that were affected by the recent hurricanes. So what can we do to help? In my last newsletter, I said, if you have the means and the time and the willingness to make donations, often raising money so we can get what's needed in those areas, supplies, recovery, rebuilding. Two of the sites I've recommended in the past has been the American Red Cross, along with UNICEF. You can go to their website to make a direct donation in regards to the hurricane, so you can specifically target it rather than just giving to the general organization. They've done they've been helpful so far already with getting in supplies, and will continue to be there for the recovery and rebuild. So I know I will be doing my part. I hope you can do your part too. There's not a lot going on with PIP currently right now. Even though the fee schedule is so far overdue. They're supposed to, again, come up with a new fee schedule to adjust for cost of living every 2 years, and it hasn't been updated since the last time it became effective in 2013. So we're going on 9 years now, and that was actually proposed in 2011, so we're going on 11 years of the last time. And with our current inflation, all our costs are going up. The price of medicine has gone up. One of the things that has come up recently, repetitively, is healthcare primary. I've had multiple clients reach out to me asking, what to do in a situation, how to bill it, how to properly document it, is it sufficient enough? So real briefly, because I've covered this in prior videos, is an insured may make an election of what's called healthcare primary. And what that says is that before their PIP insurance will cover their medical expenses, their health insurance will cover the medical expenses, and PIP will be secondary. So a couple things happen here. First, in order to do that, it must be on a completed and signed coverage selection form where the insured checks off that they want healthcare primary. The default by law is PIP primary. However, you can elect and save a little bit of money by taking healthcare primary if you have good health insurance. Often people will market without a health insurance or without indicating that health insurance. I submit that's an invalid selection, and therefore PIP should be primary. But what happens is if you do select healthcare primary and you don't have health insurance at the time you have an accident and you need treatment, you'll then be susceptible to an additional $750 deductible, which is kind of a penalty, and they can recover the amount of savings on the premiums for that policy. I don't recommend it, even if you have very good health insurance, because it really doesn't save you that much money. Now, if you do select it and you do have health insurance, what you need to do is first bill the health insurance, and then as a secondary, bill the PIP insurance with that health EOB. Now, if the health pays it in full up to the fee schedule, you don't have to bill the PIP because there's nothing else to recover. But if they apply a copay or a deductible, you can then bill PIP as a secondary to recover that. or if they reduce it less than the fee schedule. The law, and it's been interpreted consistently with most arbitrators, says that you're entitled up to the fee schedule. So if the fee schedule for a particular item is $40 and they only pay you $27, you can get the additional $13 from the PIP carrier. Now, a couple of the carriers try to fight it, particularly one in particular, but they usually are unsuccessful, and we are successful. But the important thing is showing that you billed the PIP, the health carrier, and that you sent the PIP carrier that health EOB with your bill. And you need proof of it, because sometimes they'll say, well, we never got it. So I know I've had a couple cases recently where we're fighting over it, and I got to show proof. Often it's in the form of the appeal that you send it, but you should be sending with the original bill. Sometimes you bill the PIP and only find out afterwards that it's health insurance primary, in which case then you have to bill the health and then rebill the PIP if there's anything outstanding. So I hope that cleared up for you. However, if you did not, or if you still have questions, as always reach out to me. You can call me at 732-722-2911 or email me at sean@seanhaganlaw.com, and I'm happy to answer any questions regarding the PIP. I'll even, if unrelated legal issues, if I know the answer, I will. My paralegals often can answer, but if they don't know the answer, they'll refer it to me and make sure we get you the right answer. So please, I want to talk about our provider of the month, which is Bergen Spine and Rehab. They've been in practice, as you can see from their website here, since 1980. They're located at 136 North Washington in Bergenfield, New Jersey. It's a practice that has chiropractic and physical therapy, and they also work with various specialties, whether it's pain management, surgeons, radiology, diagnostic facilities. They're open 6 days a week. If you want to schedule an appointment, as you can see here on the website, you can either call them at 201-387-2800, or the website allows you to message them, and you can put your information in and they'll get back to you. Most insurances are accepted, and they also handle auto and workers' compensation claims. So if you're in that area and you're needing a good chiropractor and physical therapy, I strongly recommend it. Congratulations to Bergen Spine and Rehab for being our featured provider of the month. So as you know, each month I do a drawing for the following month's featured provider of the month. And the way you get entered is by either, corresponding with us in any forms of way, whether it's a phone call, asking questions, whether it's emails, faxes, stopping in even, setting your demands, your files to be filed for demands for arbitration, your PIP files, at no cost to you. So any type of communication, we put you in with a ticket, and then we select a winner each month. Again, if you don't win this month, there's always next month, so keep those arbitrations coming and correspondence and questions and answers. We always look forward to seeing and speaking to all of you. So the winner this month is University Pain Medicine Center. Congratulations, University Pain Medicine Center. We'll be in touch with you to feature you next month. Well, we hope you liked this month's video. If you did, please like, share, and subscribe to the link below. Whatever you can do to help those in need, please do by contacting the two charities or other ones that are out there. Together we can get through this all, whether it's our PIP in New Jersey or natural disasters throughout our country. As always, it's a pleasure to bring you these videos. We're never too busy for your kind PIP and personal injury referrals. Thank you, and God bless.